The gentle rhythmic beep of the telemetry monitor was the soundtrack of her penance. It was a sound so far removed from the percussive, chaotic symphony of her past that it felt like a melody from another life entirely. Another woman's life. Here, in the quiet, sterile corridors of Metropolitan General's cardiac step-down unit, she was Nurse Thorne. Iris Thorne. A name as plain and functional as the gray scrubs she wore. She checked the IV drip, her movements economical and precise. Potassium running at 10 milliequivalents per hour, vital stable. Mr. Henderson in room 402 was sleeping peacefully, his chest rising and falling in a steady, reassuring cadence. Good. She made a neat, meticulous note in the digital chart, her face illuminated by the cool glow of the screen. In the reflection, she saw a ghost. A woman with tired eyes and hair pulled back so tightly, it seemed to be pulling the memories taut behind her temples. There were no traces of Major Iris Thorne, call sign Spectre, the surgeon who could piece together a soldier from Red Ruin in the back of a shaking Black Hawk. That woman was dead, buried in the dust of a forgotten black site in the Hindu Kush. Nurse Thorne was who remained, and Nurse Thorne was good at her job. She was punctual, efficient, and invisible. She did her 12-hour shifts, kept her head down and her mouth shut. She followed orders, especially the orders of Dr. Marcus Cross. Thorne. The voice cut through the hallway's quiet hum like a shard of glass. It was sharp, arrogant, and perpetually impatient. Iris turned, her expression carefully neutral. Dr. Cross stood with his arms crossed over his chest, his expensive Italian loafers squeaking on the polished linoleum. He was the hospital's star cardiothoracic surgeon, a man whose ego was as finely honed as his scalpels. "Yes, Dr. Cross?" He gestured vaguely with his chin toward room 405. "Mr. Gable's post-op drain is putting out more than 100 an hour. I want it checked every 30 minutes, and I want you to call me personally if it changes by so much as a single milliliter. You understand? Not the resident, not the charge nurse. You." "Understood, doctor," she said, her voice a flat monotone. He narrowed his eyes, a flicker of irritation crossing his face. He thrived on deference, on the slight tremor of fear he inspired in the nursing staff. Iris gave him nothing but placid competence, and it drove him insane. "You know, Thorne," he said, stepping closer, lowering his voice into a conspiratorial sneer. "I've been looking at your file, community college nursing degree, a handful of years at some rural clinic in, where was it? Wyoming." She didn't answer. The silence was her shield. "You're lucky to have a job at a place like this," he continued, his words dripping with condescension. "This is the big leagues. We have standards. Try to keep up." Not a question, a statement, a little power play to remind her of her place in the hospital's rigid hierarchy. He was the surgeon, the king. She was the nurse, the handmaiden. "I will monitor Mr. Gable's drain as ordered," she replied, her gaze unwavering. He scoffed, a short, sharp sound of derision, and turned on his heel, his loafers squeaking his triumphant retreat down the hall. Iris watched him go, her hands tightening into fists in the pockets of her scrubs. She could have told him that the increased output was likely a serous effusion, common after a complex valve replacement, and would probably resolve on its own. She could have quoted 3 peer-reviewed studies to support her assessment. She could have explained the underlying hemodynamics in a way that would have made his head spin. But Nurse Thorne didn't do that. Nurse Thorne checked the drain every 30 minutes and called the doctor. So that's what she did. She slipped into room 405. Mr. Gable was watching television, oblivious. She smiled at him, a small, practiced gesture, and knelt to check the collection canister. 110 milliliters. She noted the time and the amount on the chart by his bed. "Everything okay, dear?" Mr. Gable asked, his voice raspy. "Everything is fine, Mr. Gable," Iris said softly. "Just keeping a close eye on you." She left the room and walked back to the nurse's station, the calm of the floor settling around her once more. It was a fragile peace, a life built on suppression. She was hiding in plain sight, the most dangerous place of all. But for 2 years, it had worked. The quiet, the routine, the blessed monotony. It was the anesthetic for a wound that would never fully heal. The overhead speakers crackled to life, shattering the quiet. Code 3. Trauma 1. Code 3. Trauma 1. Multiple casualties, MVA, all available staff to the ER now. A jolt went through her, pure adrenaline, a reflex she had spent years trying to smother. Her body wanted to run. Her mind screamed to respond. For a moment, she wasn't Nurse Thorne in a quiet hallway. She was Spectre, knee-deep in the carnage of a VBIED attack, the air thick with smoke and screams. She forced it down, pushed the memories back into their box. The charge nurse, a harried woman named Brenda, was already directing traffic. "Thorne, you're with me. We're short-handed downstairs." Aris just nodded. The ER was not her territory. It was loud, chaotic, unpredictable. It was too close to the life she had left behind. But it was in order, and Nurse Thorne followed orders. They took the elevator down, the sense of urgency growing with each passing floor. The doors opened to a scene of controlled chaos. Gurneys lined the hallways. The air smelled of blood and antiseptic. Shouts and the frantic beeping of machines replaced the gentle rhythm of the cardiac unit. It was a war zone in miniature. Dr. Cross was already there, in his element, barking orders, a god in the center of the storm. He was directing the triage, pointing, deciding who was critical, who could wait. "Get me a chest tube in Bay 3, page ortho for the open femur in 5. Where the hell is my O-neg?" Brenda pushed Aris toward an overflowing bay. "Help Dr. Ramirez in here. Simple lac needs sutures." Aris nodded and slipped into the curtained-off space. A young woman was crying, a deep gash on her forehead. Aris's hands went to work automatically, cleaning the wound, preparing a suture kit, her movements swift and sure. Dr. Ramirez, a frazzled-looking resident, barely glanced at her. She worked her way through 3 more patients, a dislocated shoulder, a case of smoke inhalation, a child with a broken arm. Simple, straightforward injuries, civilian injuries. She was just another pair of hands, following instructions, staying in her lane. Then the next one came. The paramedics wheeled him in, and a hush fell over the immediate area, a pocket of silence in the cacophony. The man on the gurney was a ruin. His body was a mangled landscape of blood, torn fabric, and something else, something horribly familiar. 30-year-old male, driver in the multi-vehicle pileup, the paramedic recited, his voice tight with strain. Multiple penetrating injuries to the chest and abdomen. GCS of 8, BP is 70 over palp, heart rate 150. We've pushed 4 units of saline wide open. Aris felt the world tilt on its axis. It wasn't the blood. It wasn't the mangled flesh. It was the pattern. The specific starburst pattern of fragmentation wounds around his upper torso. The peculiar way the metal had twisted and torn. It wasn't from a car crash. That was shrapnel from an explosive device. Specifically, a directed charge designed to penetrate light armor. She had seen it 100 times before. Dr. Cross strode over, his face a mask of intense focus. "All right, let's see what we've got. Get him on the monitors. Start 2 large-bore IVs. I want a full trauma panel and cross-match for 10 units. The team swarmed the gurney, cutting away the man's clothes. As they peeled back the blood-soaked shirt, Aris saw it. A tattoo on his right bicep, a skull frog, the unofficial emblem of the Navy SEALs. Her blood ran cold. She pushed forward, an instinct she couldn't control. Her eyes scanned his body, not as a nurse but as the surgeon she once was. She saw past the obvious wounds. She saw the subtle distension of the neck veins, the tracheal deviation that was almost imperceptible, the paradoxical motion of a small section of his chest wall. "He has a tension pneumothorax," she said, her voice low but clear. Cross glanced at her, his annoyance palpable even in the chaos. "I'll make the diagnosis, nurse. Get me 100 of fentanyl and 2 of Versed. We need to intubate." "There's no time," Aris insisted, her voice gaining an edge of urgency she hadn't let it have in years. "And the positive pressure from the ventilator will kill him. He needs a needle decompression, now." "I didn't ask for your input, Thorne," Cross snapped, turning his back on her. "Get the drugs." But Aris didn't move. She was looking at the patient's face. Beneath the grime and the blood, there was something familiar about the hard line of his jaw, the shape of his brow. The team was prepping him for intubation. His oxygen saturation was dropping. 89%, 85. Dr. Cross, you are going to put him into cardiac arrest, she said, her voice like steel. He whirled on her, his face thunderous. One more word out of you, Thorne, and you're fired. Do you understand me? In that moment, the patient's eyes fluttered open. They were hazy, unfocused, but they scanned the room, searching. They landed on Eris. Recognition dawned, a flicker of disbelief, then something else. Relief. His lips moved, forming a single rasping word that cut through the noise of the ER like a rifle shot. Spectre. The room froze. Every doctor, every nurse, every technician within earshot stopped what they were doing and stared. They looked from the dying seal on the table to the quiet, unassuming nurse he had just named. Dr. Cross's jaw went slack. What? What did he say? The patient's eyes were locked on Aris, pleading. He knew her, and he knew what she could do. The monitor shrieked. Ventricular tachycardia. His heart was failing. 82%. There was no more time. There were no more choices. Nurse Thorne died in that instant, and Spectre came back from the dead. Her entire being shifted. The quiet deference vanished, replaced by an aura of absolute, unshakable authority. Her voice when she spoke was not loud, but it commanded the attention of every person in the room. Everybody out of the way, she ordered. She moved to the patient's side, her hands already grabbing what she needed from a nearby cart. A 14-gauge needle, an alcohol swab. What the hell do you think you're doing? Cross stammered, stunned into near paralysis. Aris didn't look at him. Her focus was entirely on the patient. I'm saving his life, something you were about to fail to do. She located the second intercostal space, mid-clavicular line, a landmark she could find in her sleep, in the dark, under fire. Stop her, Cross yelled, but his voice lacked conviction. The rest of the team was mesmerized, caught in the orbit of her sudden terrifying competence. She ignored him. With a practiced motion, she plunged the needle into the man's chest. There was a sudden audible hiss of escaping air. The man's body relaxed. On the monitor, the chaotic scribble of VTASH converted back to a sinus rhythm. His oxygen saturation jumped. 90%, 94, 98. A collective gasp went through the room. Aris pulled the needle, leaving the catheter in place, and secured it with a piece of tape. She looked at the patient, whose eyes were still on her, now filled with a desperate, absolute trust. Hang on, Jack, she whispered, her voice for his ears only. She knew him now. Master Sergeant Jack Ryder. She'd pulled him out of a burning Humvee in Kandahar province 7 years ago. She turned to face the stunned, silent room. Her gaze fell on Dr. Cross, who looked as if he'd been struck by lightning. His name is Master Sergeant Jack Ryder, she said, her voice ringing with authority. He has a tension pneumothorax, which I've temporarily relieved. He also has a likely cardiac tamponade from a penetrating shrapnel wound to the chest. His abdomen is rigid, indicating a massive internal hemorrhage. He needs a clamshell thoracotomy and an exploratory laparotomy simultaneously. And he needs them 5 minutes ago. She pointed to a young resident. You. Get me a thoracotomy tray, a Lebsche knife, and a GIA stapler. And tell the OR to prepare for a damage control surgery. She looked at another nurse. You. Initiate the massive transfusion protocol. I want O-negative blood, fresh frozen plasma, and platelets in a 1:1:1 ratio. And I want it in a rapid infuser, running through a warmer. She finally turned her full attention back to Dr. Cross. His face was pale, his arrogance completely stripped away, replaced by a raw, naked confusion. And you, Aris said, her voice dropping, each word a carefully placed stone. You're going to step aside and let me work, or you can stand there and watch your patient die. Your choice. For a long moment, the only sound was the steady, rhythmic beep of the newly stabilized monitor, the soundtrack of a resurrection. Cross stared at her, his mind struggling to reconcile the quiet nurse from the 4th floor with the force of nature standing before him. He saw the certainty in her eyes, the complete lack of doubt. He saw a level of command he had only ever seen in military movies. He swallowed hard, his pride crumbling into dust. He gave a single jerky nod. Do it, he croaked. Aris didn't waste a second. Get his arms up, she commanded, and the team, including Cross, scrambled to obey. They moved with a new urgency, galvanized by her leadership. The chaos of moments before had been forged into a single focused purpose, her purpose. "Someone get me a marking pen." A nurse slapped one into her palm. Aris drew a swift line from axilla to axilla across Ryder's sternum. The infamous clamshell incision, a brutal, desperate procedure rarely performed in civilian hospitals and almost never in an ER. It was a battlefield maneuver, a last-ditch effort to get to the heart and great vessels before it was too late. Scalpel. The instrument was in her hand. She took a deep breath, the world narrowing to the patient on the table, the steel in her hand, and the years of muscle memory that were screaming to be unleashed. She made the first cut. The skin parted, a red line drawn across Ryder's chest. She moved with a speed that was breathtaking, cutting through skin, fat, and muscle with an economy of motion that was almost artistic. There was no hesitation. Every movement had a purpose. "Rib spreaders," she called out, not looking up. They were placed in her hands. She inserted them and cranked them open, exposing the thoracic cavity. "Lebsha knife and a mallet." A resident fumbled with the heavy shears-like instrument. I've never seen one used," he stammered. "Place it here," Aris said, pointing to the top of the sternum. "And hit it, hard." Cross, his face ashen, stepped forward and took the mallet. He met Aris's eyes for a fraction of a second. He saw no fear, no doubt, only focus. He swung the mallet. There was a sickening crunch as the sternum split. Aris used the knife to complete the transection. She pulled the two halves of the chest wall apart like a book, revealing the heart and lungs. The heart was struggling, beating weakly within the pericardial sac, which was swollen and dark with trapped blood. Cardiac tamponade, just as she'd suspected. Metzenbaum scissors. She incised the pericardium. A gush of dark, non-clotting blood spilled out, releasing the pressure on the heart. Immediately, the frantic rhythm on the monitor began to normalize, the blood pressure ticking upward. "There," she said, her voice a low hum of concentration. She ran a gloved finger over the surface of the now visible heart. "There's the bleeder. A through and through on the right ventricle. 3-O-proline on a tapered needle." She began to stitch the hole in the beating heart, her fingers moving in a blur. She placed each suture with impossible precision, using her other hand to stabilize the tissue. It was a dance of life and death on the head of a pin. "While I'm doing this," she said, her voice never wavering, "I need someone to get control of the abdomen. Dr. Cross, you're up." It was a direct order, from a nurse to the chief of surgery, but the hierarchy had been obliterated. In this room, there was only one person in charge. Cross, humbled and awestruck, picked up a scalpel. "What am I looking for?" "Spleen or liver lac, most likely from the blast wave. Pack it off. We'll deal with it in the OR. Right now, all that matters is stopping the bleeds and getting him upstairs." She finished her repair on the heart, a neat, clean line of sutures. The bleeding stopped, the heart beat stronger, more purposefully. "Wait, all right, cardiac repair is done," she announced. She glanced at the clock on the wall. From first cut to final suture, it had taken her less than 4 minutes. She looked around the room. Every eye was on her. The resident who had fumbled the Lebsha knife was staring, his mouth agape. The nurse who was pushing the blood products was watching her with something akin to religious reverence. And Dr. Cross, his hands buried in Jack Ryder's abdomen, looked up at her from across the operating table they had created. The arrogance was gone, replaced by a profound, shell-shocked respect. "He's stabilizing," Cross said, his voice hushed. "You were right. Massive splenic lac. I've packed it." "Good," Aris said. "Let's get him to the OR. He's not out of the woods yet." As the team began to prep Ryder for transport, a quiet efficiency having replaced the earlier panic, Cross looked at her again. The question was burning in his eyes. "Who are you?" he asked, his voice barely a whisper. Iris looked down at her hands, covered in Jack Ryder's blood, the hands of a healer, the hands of a ghost. "I'm the woman who just saved your patient's life," she said softly. "That's all you need to know." But it wasn't, and they both knew it. The past had found her, and nothing would ever be the same. Hours later, the adrenaline had faded, leaving behind a deep bone-weary exhaustion and the familiar, unwelcome hum of memory. Jack Ryder was stable in the surgical ICU. Oris had assisted Dr. Cross with the splenectomy and the rest of the abdominal repairs, her role shifting from commander to an unnervingly competent first assistant. Cross had deferred to her judgment on 3 separate occasions. The OR team had treated her with a mixture of awe and fear. Now she stood in a deserted locker room, staring at her reflection in the mirror. The gray scrubs were stained with blood. Her hair had come loose from its tight bun, framing a face that looked older than it had that morning. The ghost was looking back at her again, but this time her eyes were clearer, more present. She had broken her covenant with herself. She had let Spectre out of the box. The consequences were already beginning to ripple outward. The door opened and Dr. Cross walked in. He looked as exhausted as she felt. He had changed into fresh scrubs. He stood there for a moment, just inside the doorway, as if unsure how to proceed. "They're calling it a miracle down in the ER, he said quietly. "What you did. They're saying it was impossible." Aris turned from the mirror. It wasn't impossible. It was necessary. A clamshell thoracotomy in the trauma bay. He trailed off, shaking his head in disbelief. Most surgeons go their entire careers without doing one. You did it like you were tying your shoes. He took a few steps into the room. The space between them was charged with unspoken questions. "I need to apologize," Cross said, his voice stripped of all its earlier arrogance. It was the voice of a man who had been fundamentally humbled. "What I said to you, how I treated you, I was an arrogant fool. You tried to warn me and I wouldn't listen. If it weren't for you, Ryder would be dead. I would have killed him." Aris gave a slight, weary nod. Apology accepted. She wanted him to leave. She wanted to be alone, but she knew he wouldn't go, not yet. "That's not enough," he said, his gaze intense. "I have to know." "Spectre. That's what he called you. What is that? A nickname?" "A call sign," she corrected him automatically, the word tasting foreign on her tongue after so long. "A call sign," he repeated, "like in the military." He paused. "The way you moved, the way you took command, the techniques you used, that wasn't standard ATLS, that was something else." "TCCC," she said, "Tactical Combat Casualty Care. We don't have the luxury of time or resources on the battlefield. We improvise. We do what's necessary to get them to the next level of care." Cross stared at her, putting the pieces together. The call sign, the seal, the combat medicine. "You were a surgeon," he stated. It wasn't a question. A combat surgeon. Aris finally let out a long, slow breath, a sigh of resignation. The charade was over. "Yes." "Who are you?" he asked again. The same question as before, but this time it was laced with a desperate need to understand. "A surgeon with your skills. You could be chief of trauma at any hospital in the world. Why are you here, working as a nurse? Why are you hiding?" Hiding. He'd hit the nail on the head. She sank onto a bench, the strength finally leaving her legs. The story was a stone in her gut, a weight she had carried alone for 2 years. Maybe it was time to let some of it go. "My name is Dr. Aris Thorne," she began, her voice low. "I was Major Thorne, United States Army, attached to a Joint Special Operations Command Task Force." She saw the flicker of shock in his eyes. JSOC was the elite of the elite. "I was a surgeon," she continued, her gaze distant, seeing not the locker room but a dusty, blood-soaked tent. "One of the best. I could do a femoral artery bypass in the dark. I could put a chest tube in during a freefall jump. I thought I was invincible. I thought I could save everyone." Her voice cracked on the last word. The wound was still raw. "What happened?" Cross asked gently, sitting on the bench opposite her. "Operation Nightingale," she whispered the name, and the memories came flooding back, a torrent she could no longer hold back. It was a black site operation in Afghanistan, a high-value target. Intel said it was a lightly guarded compound. It was supposed to be simple, in and out. She closed her eyes. She could smell the dust and cordite, hear the screams. The intel was wrong. It was a trap. Our unit walked into a hornet's nest. They were cut to pieces on the approach. We had a mass casualty event. Mascal. 17 critical casualties all at once, and I was the only surgeon. Her hands began to tremble. She clenched them into fists. They brought them to me, one after another. Boys I'd eaten breakfast with that morning. They were so broken. I had to make choices, triage. Who could be saved? Who was too far gone? Who had to wait? She looked at Cross, her eyes pleading for him to understand the impossible calculus she had been forced to perform. You have 2 soldiers, one with a survivable gut wound who needs a laparotomy that will take you an hour, the other with a mangled limb who will bleed out in 5 minutes if you don't put a tourniquet on him. But while you're doing that, a 3rd soldier is brought in, his airway compromised. Who do you treat first? Who do you let die? Cross was silent, his face a grim mask of comprehension. I made my choices, Iris said, her voice hollow. I worked for 19 hours straight. I did everything I could. But I lost 4 of them. 4 men died on my table, 4 men I thought I could save. A tear traced a path through the grime on her cheek. Afterward, there was an inquiry. The mission was a catastrophic failure. They needed a scapegoat. The official report signed by my commanding officer, Colonel Sterling, cited gross medical mismanagement during the Moscow. It said my triage decisions were flawed, that I failed. She let out a bitter, humorless laugh. They buried me, my career, my reputation, everything. They offered me a quiet, dishonorable discharge or a court-martial. I took the discharge. I disappeared. I became Nurse Thorne. I figured if I couldn't be trusted to make life or death decisions, I would just follow orders instead. There's a certain peace in that. The locker room was silent for a long time. Cross seemed to be absorbing the weight of her story, the sheer injustice of it. That's monstrous, he finally said. To do that to you, after what you'd been through. Iris just shrugged, a gesture of profound weariness. It's the system. It protects itself. But you saved Ryder's life today, Cross insisted. You saved him years ago too, didn't you? He said you pulled him from a burning Humvee. He was one of the lucky ones, she murmured. The door to the ICU slid open with a soft hiss. Iris was sitting by Jack Ryder's bedside. He was awake, lucid, though still weak. The forest of IV poles and the steady rhythm of the ventilator were the only sounds in the room. "Hey, Doc," he rasped, his voice rough from the intubation tube that had only recently been removed. A small smile touched Iris's lips. "It's Dr. Thorne now, Master Sergeant." "You're in a civilian hospital." He grinned weakly. "Heard you made quite the impression." "You could say that," she said. "How are you feeling?" "Like I got hit by a truck that then exploded," he said. "But I'm alive. Thanks to you." Again. His expression turned serious. "Iris, I heard what they did to you after Nightingale. I tried to find you. Everyone tried. We knew it was bull." Iris felt a familiar wave of guilt. "I should have saved them, Jack. Miller, Diaz, all of them." Ryder's eyes hardened. "Stop. You stop that right now." He struggled to sit up a little straighter. "Listen to me. Nightingale wasn't your fault. It was never your fault. I made the calls, Jack. The triage was impossible because the entire op was a setup," he said, his voice gaining a fierce energy. "The intel wasn't just bad, Iris. It was manufactured. Sterling fed us to the wolves." Iris stared at him, her heart pounding. "What are you talking about?" 2 months ago, Ryder said, his voice dropping to a conspiratorial whisper, "my team raided a data farm in Yemen. We pulled a mountain of encrypted intelligence. Took a while to crack, but we found it. Encoded communications between Colonel Sterling and an insurgent leader. He sold the coordinates of our landing zone. He traded 17 JSOC operators for something. We don't know what. A promotion? Money? We don't know." The world seemed to drop out from under Iris. It wasn't her failure. It was a betrayal, a cold, calculated betrayal. The weight of her guilt, the stone she had carried for 2 years, didn't just lift. It shattered, and in its place, a cold, hard anger began to form. "The attack today," she began, "wasn't a car crash," Ryder finished for her. "They came for me. They knew I had the proof. I was on my way to a secure location to meet a contact from the Inspector General's office. They must have been tracking me." Suddenly, it all made a terrifying kind of sense. Sterling wasn't just covering up a failure. He was covering up high treason. And now, 2 of the only survivors who knew the truth were in the same place. As if on cue, Iris's pager went off. It was a summons to the hospital administrator's office. "I have to go," she said, her mind racing. "Jack, don't talk to anyone. Don't say anything about this." "Don't worry, Doc," he said, his hand gripping her arm. "They'll have to go through you to get to me, right?" She looked at his hand, then at his face. She gave him a grim, determined nod. That's right. As she walked toward the administrative wing, a new and terrible thought occurred to her. She had performed a complex high-risk surgery. Her fingerprints, her name, her very existence were now in the hospital's record system, a system that was, like any other, vulnerable. If Sterling was tracking Jack Ryder, it was only a matter of time before he found her, too. The ghost was no longer a ghost. She was a target. The hospital administrator, a portly man named Henderson, was sweating, despite the cool temperature of his office. Dr. Cross was there, as was the head of hospital security, a former police detective named Mike Chen. Dr. Thorne, Henderson began, fumbling with her name. We have a situation. We don't know what to make of it. Chen stepped forward. An hour ago, our system was flagged by an external query from the Department of Defense. It was a high-priority search for your name and your recent surgical activity. So it had happened. They knew. 15 minutes ago, Chen continued, his face grim, I received a call, not through official channels, on my personal cell, from a man identifying himself as Colonel Sterling. He informed me that your patient, Master Sergeant Ryder, is a person of interest in a matter of national security, and that you are considered a material witness. He's lying, Aris said flatly. He told me he and his team would be arriving within the hour to secure the assets, Chen said, making air quotes with his fingers. He was very specific. He said it was a non-negotiable directive. He's coming to kill Ryder, Aris stated, her voice devoid of emotion. And he's coming to silence me. Henderson looked like he was about to have a heart attack. Kill him? Here? In my hospital? That's absurd. Is it? Aris shot back, her gaze sharp as a scalpel. You saw what they did to him in the street. They are not going to let him talk. This is insane, Henderson sputtered. We should call the police, the FBI. You can't, Aris said. Sterling is a high-ranking officer in a Black Ops command. He has clearance levels that would make an FBI agent's head spin. He'll bury you in jurisdiction and red tape while his men walk right in and do what they came to do. By the time you figure out who to call, it will be too late. A heavy silence fell over the room. So what do we do? Cross asked, looking at Aris. He was no longer looking at a nurse or even a fellow doctor. He was looking at a soldier. Aris's mind was working, clicking through tactical scenarios, just as she had done in the Mascal tent. Assess the threat, secure the perimeter, protect the asset. First, you lock down the hospital, she said to Chen. All entrances and exits. No one in or out without your personal authorization. Announce a bomb threat, a chemical spill, whatever you have to. Create chaos and confusion outside. It'll slow them down. She turned to Henderson. Second, you need to get every non-essential patient and staff member away from the surgical ICU. Clear the entire wing. Tell them it's a gas leak. Finally, she looked at Cross. And you need to get me everything I ask for. No questions asked. Anything, Cross said without hesitation. Good, Aris said, because Colonel Sterling is coming for a war. He just doesn't know who he's fighting yet. The surgical ICU was eerily quiet. The other patients had been evacuated under the pretense of an emergency maintenance issue. Now, only Jack Ryder remained, his room at the far end of the long hallway. The lights had been dimmed. The only illumination came from the glowing screens of the medical monitors and the emergency exit signs. Aris stood outside his room, a silent sentinel. She had changed back into a set of clean, dark blue scrubs. They fit her like a uniform. Dr. Cross approached, pushing a crash cart. It was loaded not just with medical equipment, but with other items Aris had requested. A heavy-duty fire extinguisher, a roll of fiber optic cable, 2 full oxygen tanks detached from their regulators. Are you sure about this, Aris? Cross asked, his voice a low whisper. Chen has his security team at the entrances. They're armed. Sterling's men will be better armed and better trained, Aris said, her eyes scanning the empty hallway, noting every shadow, every alcove, every potential angle of attack. Your security guards are a deterrent at best, a speed bump at worst. He'll get through them. The real fight is going to be here. She picked up a defibrillator paddle, feeling its weight in her hand. Heavy, solid. You should go, Marcus, she said, using his first name for the first time. This isn't your fight. "The hell it isn't," Cross replied, his jaw set. "That's my patient in there, and this is my hospital. I'm not leaving you to face this alone." A flicker of gratitude warmed her, but she quickly suppressed it. Emotion was a liability now. "Fine," she said. "Stay in the room with Ryder. Barricade the door from the inside with the bed. And no matter what you hear out here, do not open that door until I tell you to. Is that clear?" He nodded, his expression grim. "Crystal." He slipped into the room, and she heard the heavy scrape of the hospital bed being pushed against the door. Now she was alone. The nurse, guarding the patient. Just as Sterling expected. She took a deep breath, letting the manufactured quiet of the hallway sharpen her senses. She could hear the hum of the ventilation system, the distant muffled sound of an alarm from another part of the hospital. She could feel the cool draft from the air conditioning vent on the back of her neck. She was no longer Eris Thorne, the doctor. She was not Nurse Thorne, the anonymous cog. She was Spectre, and she was in her element. The hunt was coming to her. Her earpiece, a small communications device Chen had given her, crackled. "They're here," Chen's voice said, tight with tension. 4 men, black SUVs. They're not waiting for permission. "I copy," Eris whispered. "Hold them as long as you can." She heard muffled shouts through the earpiece, then the sound of a scuffle. Then silence. "They're through the lobby," Chen's voice came back, strained. "They're headed for the service elevators, on their way to you." "Understood," Eris said. She disconnected the earpiece and dropped it to the floor, crushing it under her heel. No more distractions. She moved with silent, fluid grace. She positioned one of the oxygen tanks on its side, just around the corner of the hallway, a makeshift tripwire. She took a scalpel from the crash cart, its sterile blade gleaming in the dim light. She palmed it, the familiar feel of the cold steel a comfort. Then she waited. She didn't have to wait long. The ding of the elevator from the end of the hall was unnaturally loud in the silence. The doors slid open. 4 men stepped out. They were dressed in black tactical gear, carrying suppressed submachine guns. They moved with the fluid, predatory confidence of professional soldiers. At their lead was a 5th man, older, with cold, calculating eyes and the rigid posture of a career officer. Colonel Sterling. He saw her immediately, standing alone in the hallway, unarmed, a single nurse silhouetted against the light from Ryder's room. He smiled, a thin, cruel slash of a smile. "Major Thorne," he said, his voice echoing slightly in the empty hall. "It's time to come in from the cold. You've been a ghost for long enough." His men fanned out, taking up positions, their weapons trained on her. They were treating it as a simple extraction. One vulnerable target, one unarmed nurse. "It's over, Sterling," Eris said, her voice calm and steady. "Ryder knows." "I know," Sterling's smile faltered for a fraction of a second. "Then you know why this has to be a short conversation." He gestured to 2 of his men. "Secure the asset. Be gentle with him. We need him to talk before he has his accident." The 2 soldiers started to move down the hallway toward her, their steps confident, their weapons at a low ready. "And the Major?" one of them asked. "She's coming with us," Sterling said. "She has a debriefing to attend." He looked directly at Eris, his eyes promising a world of pain. "It will be thorough." The 2 men were halfway down the hall now. They were 10 feet from the corner where she had laid her trap. "I'm not going anywhere with you, Colonel," Eris said, her voice dropping to a near whisper. "And you're not touching my patient." Sterling laughed, a dry, humorless sound. "You're a doctor, Thorne, a broken one at that. What are you going to do, hit me with a bedpan?" The first soldier reached the corner. His boot caught the oxygen tank. He stumbled, his balance thrown. It was the only opening she needed. Eris moved. She exploded into motion, a blur of blue scrubs. She didn't run at them. She ran away from them toward the crash cart. In one fluid movement, she grabbed the heavy fire extinguisher. The stumbling soldier was just regaining his footing. The second soldier was bringing his weapon up. Eris yanked the pin on the extinguisher and squeezed the handle. A massive white cloud of CO2 blasted down the hallway, engulfing the 2 men. It was a total whiteout, disorienting, suffocating. They coughed, their vision gone. She didn't stop. She dropped the extinguisher and grabbed the defibrillator paddles, their cords trailing behind her. She sprinted into the cloud of vapor. The first soldier was flailing, blinded. Aris slammed the heavy plastic base of a paddle into the side of his head. He crumpled to the ground without a sound. The second soldier fired a short, panicked burst from his weapon. The suppressed rounds thudded harmlessly into the ceiling. Aris was already moving, low and fast. She lunged forward and jammed both metal paddles against his chest, over his tactical vest. She hit the discharge button. 360 joules of electricity surged through the paddles. It wasn't enough to stop his heart through the body armor, but the raw, convulsive shock was enough. His entire body seized up, his muscles locking. He dropped his weapon and fell backward like a statue, rigid and spasming. 2 down. Time elapsed, 9 seconds. Sterling and his other 2 men stood at the end of the hall, stunned, peering into the dissipating cloud of CO2. They hadn't expected resistance. They certainly hadn't expected this. "What the hell?" one of them muttered. Aris was already moving again. She snatched the dropped submachine gun. She checked the magazine, the action. Familiar, comfortable. But she didn't fire. A gunshot, even suppressed, would bring Chen and his outgunned men running. That was not the plan. She reversed the weapon, holding it by the barrel like a club. Sterling was shouting orders. "Advance! Cautiously! Take her down!" The remaining 2 soldiers began to move forward side by side, their weapons up, sweeping the hallway. They were more cautious now, more dangerous. Aris pressed herself into a shallow doorway, making her profile as small as possible. The scalpel was in her left hand, the SMG in her right. The soldiers passed her position. They were focused on the area around the crash cart where their comrades had fallen. Aris stepped out behind them. She swung the heavy stock of the submachine gun in a vicious arc, connecting with the back of the first soldier's knee. His leg buckled with a wet crunch. He screamed, a sharp, choked-off sound, and went down. The second soldier spun around, his weapon tracking toward her. He was fast, but Aris was faster. She dropped the SMG and lunged forward, inside the arc of his weapon. Her left hand shot out, the scalpel held in a reverse grip. She didn't slash, she didn't stab. She used the blunt handle of the scalpel and slammed it into the pressure point on his wrist. His fingers went numb instantly. His weapon clattered to the floor. Before he could react, her right hand came up, fingers stiffened into a knife-hand strike, and jabbed hard into the cluster of nerves in his armpit. His entire arm went dead. He gasped in pain and shock. She spun behind him, wrapped her forearm around his neck, and locked in a perfect blood choke. He struggled for a few seconds, his training fighting against the inevitable. But she knew exactly where to apply the pressure, cutting off the carotid arteries. His struggles weakened. He went limp in her arms. She lowered him gently to the floor, unconscious. 4 down. Time elapsed, 24 seconds. Now it was just her and Sterling. He stood at the end of the hall, his pistol now drawn, his face a mask of disbelief and fury. He looked at his 4 elite operators, all neutralized, scattered on the floor like broken toys. And he looked at her, the nurse, the ghost. "You always were full of surprises, Major," he snarled. "You have no idea," Aris replied, her voice cold as the grave. She began to walk toward him, slowly, deliberately. She was unarmed. Her hands were open at her sides. She was a surgeon in scrubs walking down a hospital corridor, but the look in her eyes was that of a predator closing in on its prey. Sterling raised his pistol, aiming center mass. "Stay right there! Not another step!" The doors to the stairwell behind him burst open. Security Chief Chen and 2 of his guards rushed in, their service pistols drawn. "Drop it, Colonel!" Chen yelled. "It's over!" Sterling was trapped, Aris in front of him, security behind him. For a split second, he looked panicked. Then, a cold, calculating resolve settled on his face. If he was going down, he was taking her with him. He shifted his aim from her chest to her head. His finger tightened on the trigger. But Aris had been waiting for this, the moment he was distracted, the moment he committed. With a flick of her wrist, she threw the scalpel. It wasn't an act of desperation. It was a calculated, precise motion, honed by years of throwing combat knives in training. The small, perfectly balanced piece of steel flew through the air, end over end, not a wild tumble but a controlled spin. It didn't strike the blade. It struck with the heavy, blunt end of the handle. The scalpel hit Sterling's hand with a sharp crack of bone. His pistol flew from his numb fingers, clattering onto the linoleum floor. He cried out in pain, clutching his shattered hand. Aris closed the distance in 3 long strides. She didn't hit him. She didn't have to. She simply stood in front of him, her presence overwhelming, her eyes boring into his. The confrontation was over. Time elapsed. 29 seconds. Chen and his guards swarmed Sterling, forcing him to his knees, cuffing his hands behind his back. He was spitting curses, his face contorted in a mask of pain and impotent rage. Chen looked up from the scene, his eyes wide with utter astonishment. He looked at the 4 incapacitated commandos, a tableau of brutal efficiency. He looked at the shattered hand of their leader, and then he looked at the calm, quiet nurse standing in the middle of it all, not even breathing hard. He keyed his radio, his voice shaking slightly. "All units, suspect in custody. Code 4. He paused, his gaze fixed on Eris. "And somebody tell me, who the hell did we just hire?" The aftermath was a whirlwind of controlled chaos. Men in dark suits from the Inspector General's office had descended on the hospital, whisking Sterling and his team away into the black hole of classified justice. They had taken a long, detailed statement from Jack Ryder. They had tried to take one from Eris, but she had deferred, her exhaustion finally catching up with her. Now, 2 days later, she stood once more in Henderson's office, but the dynamic had changed entirely. Henderson looked at her with undisguised awe. Security Chief Chen stood by the wall, a look of profound respect on his face, and Dr. Marcus Cross sat beside her, not as a superior, but as an ally, a friend. "The preliminary report from the IG is staggering," Henderson said, reading from a tablet. "Colonel Sterling has been charged with treason, conspiracy, and multiple counts of attempted murder. It seems your testimony and the evidence provided by Master Sergeant Ryder has blown open a major internal conspiracy." "He got what he deserved," Aris said quietly. "Indeed," Henderson said. He put the tablet down and leaned forward, his expression serious. "Which brings us to you, Dr. Thorne." He said the title with emphasis. "Doctor, your actions in the emergency room and your subsequent handling of the situation in the ICU have presented this board with a unique set of circumstances." Aris braced herself. This was it. The part where they thanked her for her service and regretfully informed her that her employment was terminated. A person like her was a liability, an insurance nightmare. "We know why you were hiding," Cross cut in, his voice firm. "I've explained the situation to the board, the injustice that was done to you." "And we saw what you can do," Chen added from the wall, "both as a surgeon and as something else." Henderson cleared his throat. "The point is, Dr. Thorne, we would be fools to let you go. In fact, we would be fools not to recognize the incredible asset that has fallen into our laps." Aris looked at him, confused. "I don't understand." "Metropolitan General is a fine hospital," Henderson continued, a new excitement in his voice. "But we have our limitations. We are a civilian institution. We are not equipped to handle the specific and complex needs of returning combat veterans. Their injuries, both physical and psychological, are often beyond the scope of traditional medicine. Until now." He slid a folder across the table to her. "This is a proposal, drafted by Dr. Cross and approved unanimously by the board this morning." Aris opened the folder. The cover page read, "The Thorne Center for Advanced Trauma and Veteran Care." She looked up, stunned. "We want you to build it," Cross said, a proud smile on his face. "A new department, your department. We want you to create a program that bridges the gap between the battlefield and the civilian world. We want you to teach our surgeons what you know. We want you to give these returning soldiers the specialized care they need and deserve, care that only you can provide." Henderson nodded. "The board has allocated an initial budget of $20 million. You will have carte blanche to design the facility, hire your own staff, and establish your own protocols. You will answer to no one but this board." He paused, his eyes meeting hers. "We are not offering you a job, Dr. Thorne. We are offering you a mission, a chance to take the skills that were born in the worst circumstances imaginable and use them for the greatest possible good. A chance to stop being a ghost and become a leader." Aris stared at the folder, her vision blurring. For 2 years, she had run from her past. She had tried to bury her skills, to silence the voice of the commander inside her. She had sought peace in anonymity, but had only found a hollow quiet. Here, in the most unexpected of places, she was being offered not just absolution, but a purpose, a way to honor the men she had lost by saving the ones who were still here. It was a choice: run again, find another quiet corner of the world to hide in, or stay and fight, not with scalpels in dark hallways, but with knowledge in bright operating rooms. She closed the folder and pushed it back across the table. Henderson's face fell. Cross looked confused. "The budget is too low," Aris said, her voice clear and strong, the voice of command returning not as a reflex but as a conscious choice. "You'll need at least 30 million to do it right. You'll need a dedicated MRI, a state-of-the-art prosthetics lab, and direct access to the rooftop helipad for transfers." She looked at Cross. "And I want you as my head of cardiothoracic research. Your skills are wasted on routine valve replacements." She looked at Chen. "My department will require its own dedicated security detail, trained by me." Finally, she looked back at Henderson, a faint smile playing on her lips. "If those terms are acceptable, then I believe we have a deal." Henderson stared at her for a moment, then a slow, wide grin spread across his face. Cross laughed out loud. "Welcome aboard, Director Thorne," Henderson said, extending his hand. Aris shook it. The grip was firm. The decision was made. 6 months later. The operating room was a symphony of controlled activity. The rhythmic beep of the monitors, the quiet hiss of the ventilator, the soft clink of steel instruments. It was a sound Aris now recognized as the music of healing. She stood at the head of the table, guiding a team of residents through a complex microvascular reconstruction on a young Marine who had lost his leg to an IED. Her movements were precise, her instructions clear and patient. "Gently, Dr. Evans," she said, her voice amplified by her surgical mask. "The perineal artery is fragile. Think of it not as tissue, but as silk thread. Respect it." Dr. Cross stood on the other side of the table, observing, a look of deep admiration on his face. The residents hung on her every word, their faces a mixture of intense concentration and awe. In the gallery above, a group of visiting surgeons from Walter Reed Medical Center watched on a large monitor, taking notes. The Thorne Center was a reality. It was a gleaming, state-of-the-art facility that had become a beacon of hope for veterans across the country. It was a place where the brutal lessons of war were transformed into the gentle art of healing. As she placed the final hair-thin suture, restoring blood flow to the reconstructed limb, she felt a profound sense of peace. Not the hollow quiet of before, but a deep, resonant peace that came from purpose, from embracing every part of who she was. The ghost was gone. In her place stood Dr. Aris Thorne, surgeon, teacher, leader, healer. She had integrated her past and her present, forging them into a new identity, stronger than before. She was no longer haunted by the dead. She was empowered by them, driven to honor their memory by saving the living. The surgery was a success. The Marine would walk again. As the team began to close, Aris stepped back from the table, stripping off her bloody gloves. She looked through the glass of the operating room, out into the bustling world she had rejoined. She had found her place, not by running from the war, but by bringing the best parts of it home. "I am no longer a ghost, haunted by the past. I am a specter of a different kind now, a guardian, watching over those who have returned from the darkness. My penance is over, my mission has just begun, and I will not fail."